This is day 0. Had surgery maybe about 10 or 10:30 this morning. It was done in a couple of hours. Everything went perfectly. I'm now in my room for one night. I have already walked with a walker all the way around the floor a couple of times. I didn't really even need the walker as far as weight bearing. It was more for balance purposes because I'm doing really well. My legs bend. I can sit down in a chair. I can straighten them. I can bend them. Of course, I'm still on drugs from the anesthesia. They did a what do you call it when they stick a needle in your back, then numb you down below? Yeah, can't remember. But I didn't have general anesthesia, but I was asleep completely. I don't remember any of it. A spinal. They gave me a spinal, and there's a lot of pros to that. The one is, when I came out of surgery, I was completely with it. I mean, 100%. I didn't feel groggy, tired, nothing. I could think clearly. I could speak clearly. I wasn't recovering from anesthesia. I didn't feel any pain whatsoever after they took me in there. I didn't even remember them putting the spinal in, although they said I was responding and following instructions, but I don't remember any of that. So it was pain-free, basically. I've got ice, an ice thing circulating wrapped around my leg. I've got a Band-Aid. They've got these pump things on both my calves that they inflate every minute and then deflate. It's kind of to keep the blood moving, so I don't get blood clots. And I have exercises which are just basically tightening my quad muscles and then relaxing and tightening again for a minute every hour, or as often as I can, moving my feet. Foot pumps and then butt crunches just to tighten the quads. So I'm supposed to basically keep moving. I walked around a couple of times with a nurse because I'm still on an IV, so they have to, that thing has to go with me because they're still giving me fluids, I guess, and they gave me some antibiotics just to prevent any kind of infection. The surgeon came in and said everything went fantastically, and looking forward to a very quick rehab, but pain is coming. When the spinal wears off, probably sometime in the morning, it'll be completely worn off. They're giving me a bunch of painkillers, OxyContin and Librex, or I don't know. Now they're going to give me a list. I'll read it later, but I know more pain, and a lot more pain is coming my way. So right now I feel good, but I don't expect that to last too long, but hopefully it won't be horrible. Okay, I will record more in the future.